Okay, so first I would check the patient's chart before going into the room. Then I will. Hello, I'd introduce myself. Hi, I'm Olivia. I will be your nurse today. Can you tell me your name and date of birth?
Michaela Tyson, 3/16/99.
Okay, great. And Michaela, do you know where you are?
Yeah, the hospital.
Okay, and do you know what day of the week it is?
Yeah, Monday.
Okay. And then what are you doing at the hospital? What's going on?
My stomach's really upset.
Okay. So the patient's appearance, she appears state of age, groomed appropriately, good hygiene, and then on a scale from 0 being not at all and 10 being the worst pain ever, what would you rate your pain?
8.
Okay, and then you said it's in your stomach?
Yeah, my abdomen's hurting.
Okay, and when did that start?
Like 2 days ago.
2 days ago. Do you know what you were doing when that happened?
I just woke up and my stomach was really crampy.
Okay. Is there anything you've noticed that makes it worse?
Any activity.
Okay. And then have you tried anything to make it better, like a heating pad or some ibuprofen?
Yeah,
or
heating pad helps.
heating pad? Okay. And then any other symptoms with it? Like, do you feel nauseous or?
Yeah, I have like sweats and nauseous.
Sweats, okay. Okay, so I'm gonna go ahead and take your vital signs if that's okay.
Yeah.
I would wash my hands and all that before. Alright, so I'll just take your blood pressure, not on that arm. It's your pinky. Excuse me. Line this up with your breathing. Read. Okay. And I will just actually I would inflate it. Okay. Blood pressure was 114 over 72. That's within normal range. You want your blood pressure for adults to be systolic, so the top number 190 to 120. It could range a little higher or lower, based on stress and other things like that. And then you want the lower number, the diastolic, to be between 60 and 80. But that can also range as well. Alright, so we're gonna go ahead and take your temperature. Have you had a fever at all?
No.
No? Okay. Alright. Yeah. Okay, so your temperature is 98.6. And so you want your temperature to be around 96.5 Fahrenheit to 99.5 around that. But 100 point, like anything above 100.4 is a little high. Alright, and so I'm gonna check your oxygen real quick. Okay, so your oxygen saturation is 99% on room air, so that's good. You want it above 95%. And then your heart rate is 78 beats per minute, so that's good. You want it between 60 and 100. All right, so now I'm going to just look at your head, just to get a look at your head, and I'm just gonna palpate for any masses or nodules or anything. Any pain with that? Okay. So head looks normocephalic, eyes look symmetrical, and then your head is proportionate for your body. So I'm gonna look at your eyes real quick. If you can just look straight ahead and just look like straight across my shoulder. Just gonna look at your pupils. And then if you can just follow your eyes with the tip of this pen. Sorry, I'm shaking. Okay, good. So pupils, they're round, reactive to light, they accommodate, and they're equal. And then it looks like your pupil size is around 3.5 millimeters. Okay, and then if you could open your mouth for me real quick and just stick out your tongue, I'm just gonna look. Okay, and I'm just gonna look in your nose. Okay, it looks like mucous membranes are pink and moist, so that's good. Okay, so I'm just gonna look at your skin real quick. Okay, so stick your IV real quick. Okay, so it looks like, is there any pain in that arm? Like any burning or, okay, it looks like there's some slight redness. So we are probably gonna take the tape off that and just check that out to make sure. It looks like, so we flushed it earlier, so it's still patent. Let's see. It doesn't look like there's any skin breakdown or anything like that. Okay, so now just looking at your skin, so it looks like I'm just gonna feel your skin. Okay, so it's warm, it seems dry. Let me just check your skin elasticity, just make sure you're hydrated. Okay, good, turner. Okay, and then I'm just gonna check your capillary refill real quick, just make sure circulation is good. Okay, it returns in less than 2 seconds, that's good. I'm just gonna take your carotid pulse real quick. I'm gonna do that bilaterally. I'm gonna take your radial just real quick. Okay, take your brachial. Sorry. Okay, and then I would take your popliteal pulse. Sorry. I'm just. Okay, and then I would take your shoes off and get your cap refill as well. And then your dorsalis pedis pulses, post-tibialis pulses. All pulses were 2+ bilaterally and regular. All right, so now I'm just gonna listen to your heart real quick to make sure everything sounds good. Okay. So first I'm gonna start, I'm just gonna listen to the aortic. I'm gonna listen to the pulmonic. And there you would hear S2 sounds, which is good. And then Erb's point. Sorry. Okay. I'm gonna hear S1 sound. And then the tricuspid, mitral. Okay. Heart sound sounded regular. S1 and S2 were heard. No extra heart sounds or murmurs heard or anything like that. Okay, so could you sit up for me a little bit? I'm gonna start on the chest. Okay. I'm just gonna listen to your lungs. Okay. Anterior lobes were clear bilaterally. Are you having a cough or any abnormal sputum you're noticing? Okay. All right, I'm gonna listen to the back. Can you take a deep breath for me? lobes posteriorly, sounding clear. No wheezing I could hear. Work of breathing seems unlabored. Any trouble breathing, any shortness of breath, anything like that? No. Okay. And then also for the skin, I just gonna say I didn't see any wounds or anything like that. I didn't see any bruising or lacerations or anything. Okay. And then now I am gonna listen to your stomach if that's okay. How's your diet? Is it pretty balanced normally?
Yeah.
Okay. Do you think you ate anything differently that could have caused? No. Okay. And then when was your last bowel movement?
Yesterday.
Yesterday. Okay. And that everything was normal. And then when was your last urinary output? Was it clear?
Yeah,
Cloudy?
clear.
Okay. Okay, normal. Okay, I'm gonna listen to your bowel sounds real quick. Okay. Starting in the right lower quadrant. Okay, bowel sounds were normal active. They were between the range of 5 to 30 sounds heard a minute. I'm just gonna palpate real quick and just let me know if you feel any pain or tenderness. Any pain with that?
Oh wait, yes.
Yes.
Yeah.
Yeah. Okay. Right.
Mm-hmm.
Right here. Okay. What would you rate that pain?
8.
8. Okay. Pain here too. Okay, so just on that upper right. Okay. Okay, so abdomen, slightly distended, soft, contour smooth. I just think I see slight guarding, but other than that, looks good. Okay, and then I'm gonna look at your extremities. Looks symmetrical. No power that I could see. Can you wiggle your toes for me real quick and your fingers? Okay, any numbness or tingling at all? No? Okay. No paralysis or paresthesia. All right. One last thing. Okay, and does it hurt too much to walk, or do you think you could? Okay. So can you just walk towards the door and then stop and walk back? Okay, good. And then I'm gonna have you do some exercises. Just do them. Okay, can you shrug your shoulders down? And then can you do your head like this? Down and to the side. Okay, and then can you lift your leg up? Same thing. Okay, and then can you put your arms out like this? Okay, I'm just gonna test your muscle strength, so don't let me push you down. Okay, and then don't let me push you up. Okay, muscle strength 5. And then can you squeeze my fingers as hard as you can? Good. 5. Okay, you can sit down. Okay, and then I'm just gonna test your. So I'm gonna try to push you this way and don't let me.
Okay.
Okay, good. And then I'm gonna try to pull and don't let me. Okay, good. Right, so let's go to the skeletal system, all the extremities. Symmetrical, movement is deliberate, voluntary. Any pain with any of those exercises or anything? Okay, and then I'm just going to try to feel your joints real quick. Any abnormalities? Okay, I didn't hear any popping or anything like that. Any pain, like, other than your stomach? No? Okay. Okay, well, everything looks good. Yay. Okay. Thank you.